Mhm. My name is Dr. Dewan S. Raja. Today I will discuss about erythroderma, also called exfoliative dermatitis. Erythroderma, also known as exfoliative dermatitis, is a severe and potentially life-threatening dermatologic condition characterized by generalized erythema and scaling involving more than 90% of the body's surface area. These two terminology are always interchanged, but erythroderma is specifically used in dermatology. Exploitative dermatitis is used in general medicine. Here in erythroderma, we'll give emphasis on the red skin. Exploitative dermatitis, we emphasize red skin plus scaling. But the cause is same pathogenesis same. So what is the pathophysiology? Massive turnover of epidermal cells and inflammation disrupts the skin barrier, leads to heat and fluid loss, risk of infection, and systemic complications. What are the etiology causes of erythroderma or exfoliative dermatitis? If you remember this mnemonic, peat cased, like psoriasis, most common pre-existing dermatosis, idiopathic, no clear cause in up to 30% of cases, drug reaction, that is, as for example, allopurinol, phenytoin, carbamazepine, sulfa drug, etc. Cutaneous T-cell lymphoma, for example, Sézary syndrome, when you get Sézary cell atypical lymphocyte in the circulation, okay, or if it is confined to the atypical cell is confined to the skin epidermis, then we call it mycosis fungoides. This is more severe than that of mycosis fungoides. Atopic dermatitis or other eczematous dermatosis also cause erythroderma. Graft versus host disease, post bone marrow transplant. Erythema multiforme, Steven-Johnson syndrome, dermatomyositis or autoimmune disease may also manifest as erythroderma. What are the clinical features? Diffuse erythema with scaling, beginning focally and spreading, pruritus, burning sensation, lymphadenopathy, fever and malaise, hair loss, nail changes like onychomedicis, plantar keratoderma involving both the palm of the hand and plantar aspect of the foot. In chronic cases, ectropion due to eyelid involvement. Okay, so if you go here, these are two images, one from DermNet. Erythroderma, this is erythroderma, particularly in psoriasis, taken from Academic Dermatology of Nevada. Both of them have been taken from Google Image. So this is, we are seeing some scaling here, scaling is absent. So both of them are erythroderma. We can say particularly this as exfoliative dermatitis. Investigation, complete blood count, eosinophilia may suggest drug cause. Lymphocytosis in Sézary syndrome, particularly will get atypical lymphocyte with cerebroform nuclei in case of Sézary syndrome. Skin biopsy to identify underlying dermatosis or malignancy. Sézary cell count flow cytometry if lymphoma suspected. Liver function test, renal function test assess systemic involvement, culture to rule out secondary infection. What are the complications? Complications like hypothermia, hypoproteinemia, fluid electrolyte imbalance, secondary infection, Streptococcal pseudomonas may lead to sepsis, high output cardiac failure. So these are the complications in erythroderma or exfoliative dermatitis because skin barrier is lost. So there will be leaking of temperature and fluid. So certainly there is chance of electrolyte imbalance and we may have high output cardiac failure. Management, hospitalization often required burn unit level care. So patient should be hospitalized, suppose in erythrodermic psoriasis. Patient should be in the burn unit of a hospital. Identify and treat the cause. Stop offending drugs. Supportive care, temperature regulation, intravenous fluid, nutritional support, emollient, and wet reps. Antihistamine for pruritus. So we'll give antihistamine to prevent itching. Specific therapy, corticosteroid, systemic or topical depending on the disease or situation. In some inflammatory causes, immunosuppressant or chemotherapy in CTCL. It is cutaneous T-cell lymphoma, and also in Sézary syndrome, when we'll get Sézary cell in the blood. Key point, what are the key points? Erythroderma is a dermatologic emergency. Patients should be hospitalized in many cases in the burn unit, require a broad diagnostic workup because there are many causes of erythroderma. Sometimes cause is not known. Underlying cause guides the treatment according to the underlying cause. And that's all about erythroderma or exfoliative dermatitis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.